I see a lot of familiar faces. For those of you who don't know Dr. Patel, he has 5 board certifications. He's a pain management specialist and also a specialist in regenerative medicine. So he's going to talk about Prp and stem cell for about 30 or 40 minutes.
Good evening. Oh, what? Oh. All right. Ready for some fun? All right. So today we're going to talk about something new era in the medicine is emerging for last couple of years called regenerative medicine. So this field is basically deals with your own biological materials to stimulate your own body's regenerative process or healing process. So regenerative medicine consists of 2 main stuffs. One is called platelet-rich plasma, and another called stem cell-based therapy. And as we go, we're going to go into more detail. So stem cells therapy hold the promise of treatment and cures for the more than 70 major diseases that affect millions of people. There are lots of research going on all over the world to treat many life-threatening or diseases that really kills the people or makes the people disabled. Again, it's emerging field, very brand new field. There are lots of limitations and stipulations on use of stem cells. So it's taking time, but eventually we're going to have lots of diseases that are going to be cured by stem cell treatments. Militaries like US military and other militaries are working, and they're actually able to make nose and ears from the soldiers' stem cells, their own. So you can imagine, and these major diseases does not include musculoskeletal disorders that we usually do here. So platelet-rich plasma. What is platelet-rich plasma? Platelet-rich plasma contains supraphysiological concentration of platelets in a small volume of plasma. The physiologic range for the platelets concentration is usually million or more per liter. The typical concentration of PRP, you have more than 4 times up to 8 times of the number of the platelets in that particular plasma. So what are the platelets? The platelets are very small component blood cells. Everybody probably more aware of white blood cells, red blood cells. The platelets are another much important third category of the cells we usually have in the blood. Anytime your physicians does that, like white blood count studies or CBC, if you remember that includes the numbers of these. So they usually derive from the bone marrow. Bone marrow is responsible to make most of the blood cells in the body, including the stem cells. So the platelets gets generated in the bone marrow. They synthesize and release large amounts of biologically active proteins that promotes the tissue regeneration. So if there is a tissue injury, platelets will go in that area, they lyse and they release lots of growth factors, lots of proteins, and it generates the process of healing. So average life span for the platelets is 5 to 9 days. Once they release as a mature platelets in the blood, within 5 to 9 days they get destroyed by the spleen. It's just a natural cycle. And they contain lots of growth factors. So far, more than 1100 types of proteins inside the platelets have been identified by the researchers, and more numbers coming out. So power of platelets, this is like very busy slide, but it's showing if there is a damage to the tissues, all these kind of biological and biochemical reactions happens once the platelets gets lyse and releases all these growth factors and everything. So it shows there is so much platelets can do on our body to heal the body. So growth factors derived from the platelets, what they can do, they can stimulate the cell replication or division that's necessary to form the new tissue. Promotes the angiogenesis, means they leads to new blood vessel formation. Bringing the blood to the injured tissue is very important because that brings growth factors, nutrients, and other cells that helps to heal the tissue. If there is not enough blood coming in particular tissue, that tissue we won't heal. Promotes the tissue granulation formation, that's the part of the healing again. Promotes the growth of extracellular matrix, that's where they have these collagen tissues and everything gets formed in whatever the tissue is injured. So local application of the growth factors in high concentration can be done by injection of PRP. Means if you inject the high concentration of platelets in that damaged tissue, you are really stimulating the healing process and the repair of that particular damaged tissue. So platelets-rich plasma. The platelets also have something called antibacterial effects, like the white counts has or white blood cells have. So white platelets and leukocytes are the white blood cells. They can release variety of small antibacterial peptides that helps actually to destroy the bacteria and any other organism in that damaged tissue. Those peptides they release can kill the bacteria. So platelets releases two main things, growth factors and cytokines. And cytokine cell signaling compounds, basically what it happens is the growth factors signals the cell division for the tissue growth, the cytokine signals the other important cellular function to promote the tissue regeneration. Typically healing process may result in one of the following outcomes. So once you injure the tissue, one of the three things will happen with that tissue. Either there is a scar formation, that means it's the formation of the non-functional tissue. Reparation of the partially functional tissue means is partially normal, partially still abnormal. And the final is normal tissue formation, that's a fully functional tissue. So if it's the scar formation, that's useless. That actually hurts the body more. The partially functional tissue is also not as useful as the normally fully functioning tissue. So platelets are involved in many phases of tissue healing and are critical in the normal process of repair and regeneration. So the same thing, if you add lots of platelets via PRP and the damaged tissue, it really allows the process of regeneration much faster and leads to more normal tissue formation instead of the partially normal or the scar formation. How we collect the platelet-rich plasma? So you come in the office, we draw the blood, depends upon the what structure we gonna inject, and how many joints we inject, how much PRP we need for that particular joint or the tissue or the wherever we injecting. We inject, we draw from 30 cc, 60 cc to 120 cc blood, because out of 60 cc of blood, you're gonna obtain about 6 cc. So once we draw the blood, we spin it in the centrifuge. We do the first spin. The first spin separates the blood in the three layers. The bottom is the red blood cells as a red. There is something called buffy coat. That buffy coat contains lots of white blood cells and lots of platelets. And then you have plasma or serum. The plasma has some white blood cells and some more platelets, but there are lots of platelets are here in this lower portion here, or the middle portion of this, the tube. Then we respin them again. The second is, so just to show you one more time. So for the respin, what we do is we just get this out. We just take this out using the needle to another syringe, and we discard these red blood cells. We don't need red blood cells. Red blood cells are not healthy to inject in the damaged tissue. You need to inject platelets. So we take this out, and we take out this from each tube we are spinning, and then with that respin this portion again. So when with the respin, we took out this, so we get this out from here, and then we respin it. When you respin, all platelets gets aggregated here, right on the bottom. So out of that, we put the needle all the way down there, and we just get this portion out, the lower 1 cc to 3 cc, what we need. So out of 60 cc blood, you can get about 6 cc of PRP. And once after second spin, basically we get in the syringe before we do the injection. And after that, using either ultrasound guidance or fluoroscopy guidance, we inject in the tissues that we need to regenerate. The guidance to guide the needle in the tissue you want to inject is very important. You really cannot inject blindly to just assume that the platelets will reach to that tissue. You have to inject the PRP in the area you want to inject. So if you want to inject in the knee joint, you have to be 100% sure that it's in the knee joint and not outside. If you inject in any of the tendons, you have to make sure it's definitely in the tendon, not outside. If you're injecting in the facet joints or the disc, you have to make sure it's in a disc. By injecting blindly in your spine muscle, outside in the paraspinal muscle, is not gonna help at all. So that's why fluoroscopy guidance or the ultrasound guidance is very important. That way we are sure that it's 100% injected where we're supposed to inject. Stem cells. So stem cells help to create new cells in existing healthy tissues and also help repair tissues in those structures that are injured or damaged. So the one kind of stem cells we usually use is called mesenchymal stem cells. They also come from the bone marrows or adipose tissues, and we're going to talk a little bit more in detail for that. These mesenchymal stem cells are something we call undifferentiated cells. Undifferentiated cells means they can basically convert in any kind of the cells you want. So they have capability to basically become whatever the kind of stem cells you want to be. Stem cells are very important to regenerate the tissues. So if I inject the stem cells in a bone itself, those stem cells will convert them in a bone cells to regenerate the bone. If I inject them in a tendon, they're gonna convert in the muscle or tendon cells to regenerate as a tissue, as a tendons or the muscle spindles. If you inject in the cartilage, they will become cartilage cells. So they will differentiate into the tissue you inject, whatever is needed. So stem cells, they have two big qualities. One is self-renewal. They have an ability to reproduce itself indefinitely through the cell divisions while maintaining an undifferentiated state. So if I inject the stem cells in the knee joint area and I want the cartilage to regrow, they will convert in the cartilage cells and they will keep converting, just dividing and dividing until they are either dead or we don't need them anymore. When the tissue is properly healed, they stop their division themselves. So you're not getting anything overgrowth. They just stop. Potency, so they have ability to differentiate in a specialized cells as we mentioned before. So they are designed to target areas within the damaged tissue to help the creation of the new cells of the same tissue. And they are multipotent, so they differentiate in the specific tissue type cells as we want. They are also naturally anti-inflammatory, which can assist reducing pain and swelling. So if there is a chronic swelling and pain going on and chronic inflammation going on in that tissue, they can help to reduce that inflammation, and then that's why it reduces the pain and swelling. Whenever you have the chronic problem, means there is a chronic inflammation going on in that tissues. That chronic inflammation causes lots of scarring in that particular tissue. So for example, if you have a greater stroke bursa, the greater stroke bursitis is just a layman term. The underlying pathology is basically chronic inflammation of the gluteal tendons that come and attach to the hip bone. So if you look under the microscope, you can see lots of scarring in that tendon. So that tendon is chronically inflamed. Well, we do the cortisone injections to help. Yes, the cortisone helps to reduce inflammation, but it's always temporary. So it works and then it wears off, and your bursitis or the tendonitis starts coming back. And the reason is because the underlying inflammation and that scarring is right there. So it won't heal. It will just mask the inflammation for a few weeks, months, and it starts coming back. As soon as you re-injure that area, it will flare up again very quickly. So 3 types of stem cells are available or has been studied and used. One is called embryonic stem cells. That's usually taken from the embryos. Induced pluripotent stem cells, that also comes from the embryo side. Then the adult stem cells, also known as the mesenchymal stem cells. So what we use, the adult stem cells and mesenchymal stem cells, those are responsible and very successful in regeneration of these damaged tissues. So adult stem cell is an autologous source. It's your own. We don't get from anybody else. We don't get from the placenta. We don't get from the embryo. We just get these cells from your body itself. So either bone marrow or adipose tissue. Adipose means fat. They are actually found in all tissues and organs of the body. Many stem cells are also wrapped around your blood vessels, called pericytes we call. And when there is a damage, they actually gets activated and goes where they're needed. They function to repair and restore damaged tissue. They retain the ability to divide while maintaining undifferentiated state, the same thing we discussed before. So stem cells, how we do it? One, we do something called bone marrow aspirate. So you can bone marrow is almost in every bone in your body, vertebral bodies, your long bones, iliac bones, or your hip bones. The most common site is to aspirate from your hip bone from the back here. So this is the hip bone that we're talking about. So this person is lying prone on the stomach, and using the fluoro machine, we're looking for this bone here. This is the bone. We want to put the needle right in there and get in the bone marrow cavity and aspirate the bone marrow fluid from there. So see how the needle is going, not optimal placement, but just showing how we go there under the guidance. So Bmac is another name for the bone marrow cells. It's called bone marrow aspirate concentrate. So whatever we aspirate from the bone marrow, that's that fluid. So normally they do is they aspirate the bone marrow fluid, then they basically centrifuge, take out the top material, because all your mesenchymal cell material is going to be on the bottom of the syringe or the vial, and then we take that out to inject. So bone marrow stem cells is very, very potent stem cells, very effective stem cells, and they work much better than any stem cells in the body. They are more specialized, more undifferentiated, and more powerful to regenerate the tissues. And the reason is, remember, all these stem cells, mesenchymal stem cells, usually comes out of the bone marrow. They generate in the bone marrow, they stay there. After generation, they go out to the other tissues. So other tissue has the bone marrow cells or the stem cells. They're originated from the bone marrow. So these cells in the bone marrow itself are very powerful. Adipose tissue, that's the fat. So how to get the stem cells from the fat? Basically, we have to put the special procedure with a special cannula, and we aspirate the fat from your, either from the flank or the like on the side of the belly here with the special machine. Some people take out here, some people takes out here. It's not that much. So you can see under the take out from here, we suck it out, and then we have to process, because it's adipose tissue is all fat, so you have to wash them a couple of times or process different ways. or sediment them, spin it. There are different techniques with the different machines or different equipments. Eventually you get these physical separations. All this is the basically lipids and the oils. So we need to take that out the same way we take out the red blood cells, but instead we're going to take out all the lipids and oils from here. The bottom here is this material has stem cells along with some other adipose tissue material there. You don't want this in the body because this is kind of cause more problem or damage. So you don't want to inject the lipids or all these liquid oils. So we need to take that out. The studies have shown that the adipose tissue contains as much as 500 times more stem cells than those seen in the equal weight of the bone marrow. So adipose tissue stem cells also differentiates in the different tissues as bone marrow cells. Bone marrow cells are much more powerful, as I said, much more effective compared to the adipose tissue cells. And they differentiates in more tissues than the adipose tissue itself. So what's the advantage? Advantage is basically you can get lots of stem cells from the adipose tissue compared to bone marrow. Plus, with the aging, there is some decline in the bone marrow fluid and stem cells. The adipose tissue stem cells really doesn't get declined. Disadvantages: adipose tissue stem cells are locked in a collagen matrix in the fat, that thick material, gooey material I showed you on that tube in the bottom. So they are not really as separated as like bone marrow. Bone marrow fluid is just a liquid like a blood. This adipose tissue cells is like more thicker tissue, like more gooey, or I would say paste-like material. So it's you cannot really inject those in everywhere. You can inject those things in mainly the big joints like hip joints, knee joints. But if you have to inject in a facet joints or disc joint, you cannot inject. It's too thick for those tissues. Something called stromal vascular fraction. Stromal vascular fraction is basically that adipose tissue. If you digest all the fat and everything out of that fat by using some enzymes, at the end you get clean liquid material. That's called stromal vascular fraction, and that's full of stem cells. There are lots of stem cells in that, like a bone marrow liquid has it. But to do that, you have to digest that fat using some different enzymes. When you do that, it violates the FDA regulations. FDA regulations, you cannot manipulate stem cells more than something called minimally manipulation. So when you digest them in the enzymes, you using chemical digestion, chemical process, and that considered more than minimally manipulation of the mesenchymal stem cells. So that's against the regulations. If anybody is doing that, that's illegal. So more than minimal manipulation stem cells is not approved by the FDA. And the theory behind that is when you use the chemicals to digest the fat, it can affect the stem cells in bad ways. So either stem cells don't work, or those stem cells gets mutated in the layman term because of the chemicals, they can lead to the tumor formations anywhere in the body. So you have to be very careful about that. So this adipose tissue stem cell therapy is kind of a gray area. There are no specific or clear-cut rules. You can use it, you cannot, but if FDA comes and decides that whatever the doctor or facility doing is more than minimally manipulations, they get in trouble. Now in the UK, everywhere in Europe, they do this often. They have approval, and as usual, the Europe usually does everything. The US, it takes a long time to do anything like this. So what is the difference between PRP and stem cells? So we talk about both treatments, PRP and stem cells. So we're gonna do a little bit of difference. So in terms of the clinical effect, so they did one study. It's known as something called wound healing study. They had few healthy volunteers, and they basically did is they burned the 3 areas in their forearms using the laser, and then what they did is they injected those 3 areas. They treated those 3 areas, one area with nothing, one area for PRP only, one area for the PRP and adipose tissue stem cells. So this one is they injected nothing, and unfortunately I don't have the previous picture, but you can see still the red and it's barely healing. This one was injected with the PRP, and you already see the healing is happening. You can see that crustiness and those healing coming on. This is with the PRP and adipose tissue at the day 6, and it's almost healed. This is day 14. Now it's just forming little scabs and silky thing. That's more of crusting, less crusting, more healing. This is almost healed.
They didn't do any just stem cells. How do you know that last one, the primary rich plasma, even contributed?
I didn't understand. So this one you mean?
Yeah. If you just did stem cells, maybe that would happen like that.
Right. So they wanted to show that combined effect. I understand they should have done vehicle, PRP, and just stem cells. But what PRP does, it along with the platelets, when the platelets release all the growth factors, those growth factors do attract more stem cells from the body. So they will signal the body to send more stem cells there. The problem is you won't be getting as much as stem cells you want there compared to when you physically inject those stem cells right there. The other problem is when the tissue is damaged as a chronic tissue and there is a scar formation or something, there is no blood going there. So if the blood is not going there, even though if the body wants to send the stem cells, they're not going to reach there. There is no vehicle, there is no transport to send the stem cells with that damaged tissue. So when you inject right in the tissue with the injections, you're not worried about bringing the stem cells from other side of the body to here in the damaged tissue. Now those stem cells will start regenerating the tissue, or the PRP regenerated tissue, forming new blood vessels, getting collateral blood vessels, and now lots of blood is going to start flowing. So it heals. So that's called the healing cascade. So with the PRP and stem cell procedures, things to avoid or limit, we usually ask patients not to use any anti-inflammatory medications or the steroids 2 weeks before and 2 weeks after the procedure. And the reason is we want that inflammation going. So when you inject the platelets, PRP, or the stem cells, what it does, it causes a pro-inflammatory response, means that tissue has inflammation going. And inflammation is the first step in the wound healing. If you take the steroids or you continue using the anti-inflammatory, it's going to suppress the inflammation. You don't want that. For the stem cells, local anesthetic and contrast dye could be the cytotoxic. You can inject the skin with the local anesthetic, that's okay. But when you inject in the joints or the disc, the stem cells, we usually don't inject contrast or the anesthetic in the disc or the joint itself. So we numb up the skin with the local anesthetic, but we don't put the numbing. If anybody has injections, we know we do the mixture of numbing and cortisone when we do the injections anywhere. So we don't do that for the stem cells. For the PRP, it's okay with the anesthetic or the contrast dye, or not the stem cells, because that could be cytotoxic and they can kill the stem cells. Antibiotics may be also cytotoxic. So when we do some kind of disc procedure, not the stem cell, we usually give patients antibiotics just prophylactically. When we do the stem cells, we usually don't do that. What are the contraindications for these procedures? So if you have any kind of cancer, particularly you have blood cancer, leukemia, lymphoma, you have problem with you have blood cell disorders. Lots of people have low platelets. They are on anticoagulants. Anticoagulants is not absolute contraindication, but depends upon where you inject and whether you can stop or not. So if you are injecting in the joint, tendons, if someone on anticoagulants, they cannot stop, it's okay. But if you want to inject in the like in the disc, you have to stop. And this is not direct effect on the PRP or stem cells, it's just a procedural risk. If you want the anticoagulants, you don't want to do discogram or put the needle in the disc because it's very high risk of bleeding in your spine and epidural space. You don't want that. Yeah.
When you're injecting it, does it help if you have like with me, it's always my bones, they seem to rub up against whatever the bones never heal. So when I get my injections, it only lasts a certain period of time. Maybe after the injections, I'm good for 2 or 3 weeks, and then I have to come back and get more injections. Well, with this, does it go right into the bone and heal it? So there will be no.
The one we're doing is no. If you have bone issues that you have to inject inside the bone, that's usually done by the orthopedic surgeon.
So
We're talking about you have bone pain, but it's not really bone pain. It's more muscle pain or the disc pain or the facet joint pain.
So this would help.
Yes.
And would it cure it, or would it?
I cannot say cure, but it definitely help. We'll talk more about that. If someone has severe osteoporosis, again, is more procedural risk, then it's contraindication to the PRP or stem cells. Just more risk of the fracture and those things. In any area, too severe a pathology. So if someone wants the injection in the disc, but if that the lumbar disc but if that disc is there's nothing left, you cannot regrow that. You have to have a certain tissue there to regrow. So if someone comes really that 10% disc left, it's not going to work because there is nothing to regrow there. You need some medium there to help regrow. So pre-injection protocols, again, the anti-inflammatory NSAIDs and non-steroidal anti-inflammatory medications have negative effects on the platelet function, which may decrease the growth factor release. Most authors recommend stopping for 5 days before and up to the 2 weeks post-injection. We usually here stop 2 weeks before, 2 weeks after. Now, if someone comes and says, I'm taking anti-inflammatory for my whole body arthritis and I cannot go without it, then it's okay to take it. But I explain them, hey, there's a chance it may not work because we, getting inflammation down, but at the same time, you don't want to take the anti-inflammatory away and make them suffer for 4 weeks. That makes no sense. What to expect after these kind of treatments? It is absolutely normal to feel very sore or increased pain for 2 weeks after the injections. The reason is, as I said, this treatment leads to the inflammatory response. So anytime you have inflammation, you're going to have increased pain for 1 to 2 weeks. For first 48 hours, you should rest the area and use as tolerated. So you take it, take it very easy. That doesn't mean you have to be bedridden, but you try all your normal activities, slow down, take it easy, do the heat versus ice, depends upon the treatment. For the next 2 weeks, you should perform just light stretching and range of motion exercises without really, overloading the joint or the area. 2 weeks after the injection, you should begin strengthening exercise under the direction of your healthcare, means physical therapies. If you already know what to do at home exercise, you can start that slowly. So physical therapy is also important along with this treatment. Yes, this will heal your tissue within 8 to 12 weeks. But at the same time, you have to develop the muscle tone and some muscle strength to support those areas. So if you do the injections in the knees and knees osteoarthritis gets better, cartilage gets repaired. But if you don't support or strengthen the muscles around the knee joint, you're going to damage that again. But those are, the muscles are the like pillars to support all these joints and discs and everything. So maximum results are achieved after 8 to 12 weeks, may require additional 2 to 3 treatments. So the recommendation is once you do one injection in one area, we should wait about 8 to 12 weeks, at least 8 weeks before even deciding whether this treatment worked or not. At the end of 8 to 12 weeks, we decide, depends upon how much response you got, whether you need second one or third one. In other doctors' experience who is doing this for a while, they say if people require 2 or 3 treatments, the results can last up to 2 years, 2.5 years or longer. For platelet-rich plasma, the stem cells last much longer. So in my last lecture at the seminar, I told people liked it. I said PRP is a Kia, stem cell is a Lamborghini. So it all depends. I said PRP treatment is like buying Kia car, versus stem cell is a Lamborghini. So stem cells, so here is other little bit explanation. Sometimes we do the stem cells injection alone, sometimes we do the PRP injections along with the stem cells. It depends where we inject, in which structure we injecting. Not as common, there is no common practice. It all depends upon the preference. Some physician says use both, some says no, use only one. But it all depends where we inject and how the structure is. So for example, if you're injecting the lumbar disc, and if you think the lumbar disc has tears around the nucleus, so disc has the outer layer of the thick fibers and then your nucleus inside. The goal is to inject stem cells in the nucleus itself. So many times, if we are not sure, we do something called discogram, means we put the needle in the disc and we do the testing that if that particular disc is really painful or not, or 1 disc, 2 disc, 3 disc. And when I do that, sometimes we see the tears in the disc, sometimes we see the contrast dye leaking out of the disc, means that disc has a tear. So in that case, we usually combine the PRP and stem cells. So we inject the PRP first and then inject the stem cells later. And the reason to do that is PRP is more sticky material. It's more fibrous sticky. So when you inject that, it creates like fibrous sticky network. Same time, I'm not talking about like you come back for the stem cell 2 weeks after. As soon as you inject, it sticks to the disc, it sticks to the capsules and the joint. And then you inject the stem cells, they're basically stuck to that fibrous network. The stem cell stays there, so it doesn't leak out. Stem cells is liquid, much liquid. You know, it's like blood. So it's a very liquid thing. So if you inject in the disc that has a tear, it can leak out and you lose it. So we put the PRP first, and then we put the same time, but like we inject the PRP first through the needle, and then we inject the stem cells to help the stem cells stay there. If the joints we inject, there is a tear in the capsule or something, we do the same thing. The joint is okay to inject PRP and stem cell if you want, but when it comes to the lumbar disc or the facet joints, it's little challenge because this disc doesn't hold too much volume. In the disc in the lumbar spine, it can hold probably 2 to 3 cc max volume. So now if you inject PRP, then you're not going to be able to inject too much stem cells. So if you don't need to inject PRP, you want to inject more stem cells. You want more stem cells inside, more numbers. So if there is no need to inject PRP, we don't inject PRP, just go straight to the stem cells.
When the stem cells, when you withdraw the stem cells from the area that you want to re-inject, what is it mixed with? Are you using some of the embryonic stem cells with it, or just your own?
Just your own. I don't use anything else. just your own, nothing else. It had the only thing we do is we flush everything, the needles, syringe, everything with something called heparin. It's anticoagulant. We don't want, I draw the blood or the bone marrow stuff, if I leave it alone, it will clot right away. So basically we mix with a little bit of heparin, that's anticoagulant. So lots of doctors uses, they draw the bone marrow fluid, they centrifuge, and then they inject afterwards, like PRP. The kit I use for the bone marrow aspiration is a special kit and a special needle. So when I draw the bone marrow fluid, I don't need to centrifuge. It's pure stem cell containing fluid, so I can aspirate and just inject right away. It's just a difference between the needles you use. It's just mechanical, biomechanical stuff. Yeah.
Would your process work in place of a partial knee replacement? Person doesn't need a total knee, they just need a partial knee. Would this process work instead of?
There is no study for the stem cells. I have seen and heard the orthopedic surgeons do are okay or do inject the PRP. With the stem cell, I think they are worried about a little bit more complications when there is a hardware in the joint. Because as I said, stem cells are very powerful and undifferentiated, so they don't know what exactly will happen. With the PRP, they say it's a good choice.
Why does it need FDA approval? It's not food and it's not a drug.
For stem cells?
Yeah.
From the fat?
Why does it need the FDA approval?
Because to get the pure stem cell out of the fat, you have to digest it with a chemical. So when you do that, they call it a major manipulation of the stem cells. So that can cause mutations or damage to the stem cells. And if the damaged stem cells can cause a tumor formation. So I didn't mention, but like embryonic stem cells, when you get the from embryo, they are very, very, very potent to cause tumors. So, and when they were trying to do the embryonic stem cells in the people, those people develop tumors, systemic tumors or the local tumors, because they become like tumor cells. So coming from the mesenchymal stem cells from the bone marrow, the adipose tissue, they don't cause tumors because it's autologous from your own. The only thing is that adipose tissue stem cells, you have lots of stem cells, but it's very hard to get those ones. The only way you can get that high number, 500 times, they say, compared to the bone marrow, is if you really digest and get that liquid stem cells in the bottom. But that means you have to digest them with the chemicals, so that's against regulation. Is FDA going to change in next few years? I don't know. There are a couple of bills in the Congress and the Senate in the Washington D.C. to clarify all those things, to speed up this process, because it's working so amazingly, stem cells, for all these treatments, that everybody wants for the FDA and the government or the Congress to act on it to loosen some regulations.
You're injecting the PRP and the stem cells in a disc.
Yeah.
Basically to grow the material that's inside, to fluff up the disc a little. Is that what it's for?
No, it's just the fluid inside there.
Yeah.
So what happens is that stem cells we're injecting is not staying there for 12 weeks. Those stem cells we injected, they're gonna die within 2-3 days. But before they die, they signal the body and the tissues to start repair. So they're not gonna stay alive there. They will, basically divide as much as they can, but that's signaling the whole healing process. And that growth factors is much important, because they are the one who's gonna start the healing process, regenerate the blood vessels. If you inject them in the disc, they're gonna start increasing the water in the disc. That's very important, because there is something called proteoglycans in the middle of the disc. That's the nucleus. So that nucleus is shock absorber, but there has lots of water, so lots of elasticity. And as we get older, you lose water and you lose that elasticity. There is no blood vessels going in the middle of the disc. There is no blood supply. So when this material gets more water in, they get the water actually from the vertebral bodies, from the end plates of the vertebral bodies, the water seeps in. It diffuses.
Why couldn't you just inject microfiber, some synthetic stuff,
Right, but it won't regenerate the tissue. It won't grow. It will fuse you if you go different way, yeah, because it's gonna calcify. You can have calcification all over the place. If you put something, it's gonna lead to the fusion of that segment instead of it's regrowing the disc.
Insurance doesn't cover anything on it though, does it?
Nope.
Yeah.
So I like this one. I stole this slide from somewhere, but it says stem cell farming. So stem cells are the seeds. You can add PRP or the growth factors and cytokines, and that's the fertilizer. So once you inject the stem cells, they will attract the growth factors. There's lots of other tissues around. Stem cell itself gonna get more growth factors where you inject. So it's kind of fertilizer for the stem cells. The surrounding tissue is the soil. The vascular supply is the rain or moisture. Regeneration and healing is desired crop. So without seed, fertilizer, moisture, or good soil, there is likely to be no crop. You need all of the above. The PRP is still the option, but it's basically starting. You inject stem cells or PRP, so you get growth factors, you get cytokines that will really make this soil rich, tissues around that will increase blood supply, get more blood out there, more growth factors, more stem cells, more oxygen. Obviously, you need oxygen for the tissue to regenerate, and that's how it goes. And that's why it takes longer time. It takes 8 to 12 weeks.
Is that with just one needle? Is all this, if you just did one needle, injected one
PRP and stem cell both, yeah.
it's just one time?
Yeah, you inject PRP first and then stem cells if you're doing both. You cannot mix outside. That's against FDA. Because if you mix it, that means you create a drug. But you can first inject one cc of PRP, and in the one syringe and other syringe, you can inject the stem cells.
So it would take a one-time injection for the PR, for the stem cells to start
Yes.
growing and everything?
Yes. And as I say, after 8 to 12 weeks, we reassess and see how you do. And then if you need the second one, in case of the PRP, you do it. But it depends how you respond to the first one. So it's like epidurals or steroid injections. You may need more than one to get enough inflammation down. The PRP stem cell kind of the same thing. But in this, most of the people get much better with the one treatment. Possibly you do the second one, it can last longer. So it also depends upon how badly the tissue is damaged.
What would be determining how bad it's damaged, from a fall or from?
Well, we depend on the X-rays or MRI reports and seeing how badly damaged the tissues inside. I mean, cause for the damages can be anything. Could be not acute trauma, maybe just the micro trauma over the years. So Prp and stem cells, what it has been used for? The osteoarthritis of many joints, all tendinopathies, that's rotator cuff, Achilles tendon, plantar fasciitis, hip bursa, you name it. Everything we can do. Tennis elbow, golfer's elbow, sacroiliac joint, acute sports injuries. These sports people like football or basketball, sometimes they have the tendon tear or something. And in the recent years now, they just go and have PRP, inject the PRP, and they're back on the field within week, 2 weeks, 3 weeks, compared to 6 months. So degenerative disc bulging or herniated disc, facet joint pains, carpal tunnel. We inject in the carpal tunnel now. We inject in the piriformis muscle if you have Piriformis Syndrome. This is just this. I'm showing some pictures. In the ultrasound, you can see this is the rotator cuff muscle. So if you have to inject, we use ultrasound machine, just bring the needle in the muscle and we inject it. Little more picture. This is how the rotator cuff muscle looks in your shoulder. Tennis elbow. So the people who have pain in outside of this elbow area, not able to do some functions with the hand because it hurts so much, you can do that because there is always a tear here. And many times when the patient comes and they have this pain keep coming back, whether in the rotator cuff or in the shoulder, elbow, or the hip joint, when we do the MRI, 99.99% time we find the tear there, partial tear in the muscles. Partial tear means some of the fibers has been torn. And then, as I say, you see that chronic inflammation. And if you read your MRI report, it would say tendinopathy or tendinosis. That's chronic inflammation. If you see tendinitis, that's acute inflammation. So someone just injured 2 days ago, and if you do MRI, you see the more fluid and more inflammation under the MRI or ultrasound, that's called tendinitis. Someone who has this pain for the ears or keep coming back, you do the MRI, you will see either partial tear or tendinosis, tendinopathy, all those things. That partial tear in the patients who have the pain for a long time, not because they injured something recently, it's just partial tear because of the chronic inflammation and scarring. So it's very easy to tear that. And it also gets weaker. The weaker the tissue, it's easy to tear.
So even if the tear is years old,
PRP stem cell will heal it. Yeah. This is the hip bursa area. So all these tendons comes and attach. That's have tendinopathy. Achilles tendon. Knee joint arthritis. The only limitation is if you have meniscal tear or the cartilage tear in a certain area in the knee joint, it's very hard to treat that because again there is no blood supply. So only way you can treat is if you physically inject stem cells in that cartilage area. Usually orthopedic surgeon can do that. It's very hard to do with the ultrasound or the fluoro guidance. They may have to do arthroscopically because it's very hard to see those tissues with the X-ray machine or the ultrasound. Yes?
Would it help IT band problems?
Yes.
Really?
Yes.
Would you have to hit each band or what?
No. ITB band does not cause a pain, does not have the problem at whole band. It has a problem either by the knee or by your hip joint area. ITB band comes from all the way from your hip to the knee joint.
And it would help all of them.
Right. You don't have problem in the middle. It's just because of the problem either knee area or the hip area, whole IT band hurts because it's become so tight and gets inflamed on those areas. So it will do like refer pain. It's not the whole ITB band is damaged. Plantar fasciitis is very common. We do that too. Back pain. So in the disc herniation, disc bulging keep causing pain. Lately we also doing the facet joints. It's also used as a vampire facelift. Yeah, they do something called Prp Micro Needling. So you can use this micro needling device and put the PRP on the face. It really improves the quality of the skin. I'm just telling you the uses now. Prp hair restorations, there are several studies came out injecting PRP can regrow your hairs where you are kind of losing hairs. Wound healing, people who has like bed sores and other kind of wounds that are not healing with the normal procedures, they start injecting PRPs and stem cells and it heals very well now. I don't know, I can treat that. So you can use in the ligaments, people who have chronic ankle sprains because of the weakness of the ligaments, you can definitely inject in those ligaments to help it. So usually who undergoes PRP and stem cells therapy? It's getting very popular, so lots of celebrities are going for this. Some of the people I know. So lots of athletes has recently.
What about spines that are deteriorating from old age?
It can help, depends upon how bad it is, as I say. He injured his Achilles tendon, I think, 2 years ago, and They did the PRP, and he was back on the court in 4 weeks, or 2.5 weeks to 4 weeks.
Now, what was Nadal getting?
Back. He went outside of country. I don't know where he did. He had his cervical disc.
When you extract the stem cells from the bone marrow, are you getting just 100% stem cells with nothing else in it?
Where you get
Before you can re-inject it.
You can get some of the other cells too with the bone marrow. It's very hard to just isolate the mesenchymal stem cells only. You have other cells, but those cells also helps to regenerate the tissues. Yeah, they have something called hemopoietic cells, like from there where the platelets can also regenerate, and some other unnecessary cell just die, and it just gets clear by the healing process. So the healing, something to heal, basically what happens when you inject is that inflammation gets more cells. There are the cells who design to come and basically destroy the scar tissues or unnecessary stuff. You have white blood cells coming, so anything unnecessary stuff is going to be digested or destroyed and go from there, and then it starts regeneration. So first is the cleaning process. So they have to clean out all this scarring, all these bad tissues around there. That's where the inflammation can happen, and that's why you have increased pain for 2 weeks. Once that part is gone, then the healing starts slowly. So the way it works is, if you have PRP or stem cell done today, you're probably going to have increased pain for 1 to 2 weeks. By 2 weeks, 2.5 weeks, it will come down to possibly baseline, before, like almost same pain you had before the procedure. At that time, you will feel like, oh God, it didn't help. I bought the Lamborghini, but it's not working, right? As the weeks goes, after 4 weeks, you're gonna realize that, wow, it's working. So that's why it's 8 to 12 weeks healing process. So it's not exactly as a steroid that it starts working in 3 days, and in 10 days, you can go out and do anything. So you have to have patience. Remember, if you have this pain for the years, 3 more months is not big deal. And this is you getting natural healing process. Very, very good idea. Steroids have lots of side effects. Their study came out about a month ago. They did this 2-year study of injection of steroids. They did for osteoarthritis, they did the steroid injections, I think 1 injection every 3 months or 6 months for 2 years. And then they did for 1 year. And they followed the patients for 2 years. And at the end of the 2 years, patient came back with the same pain, no change in the pain, no healing, nothing. Plus, their knee cartilage gone. So you cannot keep injecting steroid in the tissues over and over again, because it can lead to more damage. And the same time, the study came out that the PRP or stem cells is actually reverses the osteoarthritis. They did the PRP and stem cell injection. I think only the PRP in the hip joint arthritis, moderate arthritis, not really severe. And they did the MRI before PRP, and then did the MRI about 9 months or 12 months after. They actually see increase in the space joint. So it's like reversing the osteoarthritis. I went to a conference a couple of months ago, and one of the doctors said he's a pioneer in doing stem cell therapy, not just the injection. He's also heavily involved in the research. And he said within 10 years, 15 years, there are going to be no joint replacement. Not just this, they are also working on a commercial production of the stem cells. So we don't even take your own. You come in, we just get this bottle from the freeze, dry it up and inject. Will be going out. I don't know when this is going to happen, but they are heavily working on that.
What is this?
This is a vampire facelift.
Oh my gosh.
They both.
Oh, go back to that one.
Is there any further development with the eyes for stem cells?
Yes.
for macular degeneration.
Yeah, I'm just talking about the musculoskeletal, but I'm just talking about the musculoskeletal joints in the spine. But there are so much. They are already doing the treatments for the eyes. They are treatment for some brain disease. They also do the IV infusion of the stem cells to work with the COPD, asthma, lung disease. They are injecting stem cells for the heart disease. You name it, they're doing everything. They're injecting stem cells for the bladder. It's everywhere. Now, those centers are under research or investigational or research institutes. So they are under umbrella of the FDA, and in that case, they can use the chemical digestion to get the stem cells, real stem cells out. You cannot do the IV infusion for the bone marrow stem cells or that gooey material. So you have to get that stromal vascular fraction I talked, that liquid stem cells from the fat. But because they are under research and investigation, they are like under the IRB boards, they are allowed to do that because it's a control. And they have lots of other doctors around the countries involved: urologists, orthopedic, primary care, pulmonologists, cardiologists, cardiothoracic surgeon, you name it.
They're doing clinical trials in those areas?
Yeah. You may have to find it.
Go to NIH.gov.
Right, you go NIH.com, or if you look on the internet, you can find where the trial's going.
But nothing in the Melbourne area.
No. This mainly happens in the more academic centers. So if you go like Shands or University of Miami, John Hopkins, lots of in California.
So if somebody has degenerative disc joint disease through their whole body, and it's been put into hyperdrive, and then we told them their bones are really aging twice the outside age, can this help? Can this actually stop that and bring it back to?
Well, when it comes to joints and everything, you have to inject each joint. The joint is different than the systemic disease. But if you are like osteoarthritis of each joint, it's a systemic osteoarthritis. But in that case, the systemic stem cell therapy won't work.
The degenerative disc and joint disease that can help?
Yes, if you inject locally, yes. Again, if I inject the stem cells in the IV in your blood, it will stay in the blood. But if that joint is arthritic, that cartilage is damaged and there is no blood supply going, how am I going to get this? The stem cell is not going there.
Right.
So it's not that once the body has injured something, body tried to get the stem cells there, but there was no blood vessel there. There's a scarring there, so there is no blood. So other thing I forgot to mention is that we also sometimes do low. So if you heard like a bursa and there's a tendinopathy there, chronic inflammation. So before we inject PRP or stem cells, under ultrasound, I put the needle, or the doctor will put the needle, and they do needle fanning. So we just try to break up those tissue in the tendon. So that generates some inflammation, but we break up some scarring, and then we inject the PRP, it works better.
So we're going about price. What idea of prices of each one?
This is Deuk Spine Foundation, so I cannot talk about price.
It's not covered by Medicare.
Not covered by any insurance, and there is no hope for covered by any insurance at this point. Everybody's working to get that coverage. So anytime we do the injections, not the stem cells yet, but the PRP, they have like temporary code. So even though Medicare is not reimbursing that, anytime we do in a patient who has Medicare, we have to report that. So the Medicare uses that information to see what's going on, and they also, I guess, watching all these articles coming out, the scientific articles and the clinical trials and everything. So maybe possibly sometime in the future. In short, they will save lots of money in the long run. But at the same time, if someone's saying that in 10-15 years there's going to be no joint replacements, I mean, there are lots of businesses going to be closed. So they won't let it happen. That's my theory, Aaron.
Just like a subcategory of prolotherapy?
Well, this is kind of extension of the prolotherapy. The only difference with the prolotherapy, in the prolotherapy you still depend upon body's response more. So the prolotherapy, the way it works is the same thing. You irritate the tissue. You irritate the tissue with the high concentration of dextrose or some other phenol or something to damage the tissue or irritate it. So when you irritate, you generate inflammation to get more blood, more cells. The problem is you're not getting as many as growth factors you can. And the prolotherapy works mainly on the ligaments. It really doesn't work on the muscles. If you inject in the muscle, you can actually injure the muscle because of the high level of dextrose or phenol. The prolotherapy is very good for the capsule or the ligaments of the joints. You want to work on the tendons, it want to work on the disc, you want to work on the, possibly may work on the facet joints. Yeah.
If one's told that they need a knee replacement will last X amount of years, and the stem therapy is going to last how long? As long as the knee replacement, or?
Yeah, it may not last as long as a knee replacement lasts. But I mean, if it lasts 2 years, after 2 years, you still have the chance to do another stem cell therapy.
Is that about 2 years?
2 years or longer. And as I say, it depends upon what you do afterwards. So if you inject the knee and your knee pain gets better, your osteoarthritis gets reversed, remember, you're still in the same process of getting osteoarthritis, right? You're walking, you're jogging, you're doing, so you're injuring the tissues. That's why you have to do the physical therapy, home exercise, keep that knee going. All right, you injure the knee, now you inject the stem cells, make it better. Now you have to, with the exercise, you have to support it so you don't get arthritis back.
Well, and the knee replacement should last how long?
Forever. I think it says 10 years, 9 to 10 years.
I had both my knees done in 2001. I had a hospital a week before 9/11 happened. Still going. They're titanium now. That's what mine are.
Oh,
They last forever. The only thing you have to do is put a microscopic incision for the meniscus. And it's like a hockey puck. So you put it in, take it out, go on the next nerve, right out, surgery the very same day.
Medicare paid for it.
Medicare paid for it.
Well, I'm a veteran, so VA paid for it.
Rotator cuff tear.
Yeah.
Now, will this kind of therapy fix a rotator cuff
Yes.
tear without surgery?
Right. It depends on the tear. If you have full thickness tear with the retraction of the rotator cuff muscle, then it won't. So if you look at the rotator cuff, they will say you have a tear, but what kind of tears you have? Partial tear, full thickness. Full thickness tear means that the muscle just completely unattached from the bone, and it pushed back here. You cannot do anything there. You cannot. That's not gonna regrow like that. It's not like Alien movie or something. In future, I don't know. Future, yes, they're growing ears and nose out of the stem cells.
So in other words, it's going to be sewn. So if you have a partial tear,
That will heal it.
it will regrow.
Correct.
You only use bone marrow?
Yes.
No embryonic doesn't?
Oh, no embryonic, no. There are other product available in the market is amniotic fluid cells. It's a whole different than embryo and placental. Amniotic fluid is basically from the amniotic fluid from the mother, and it's good, and the source wise I'm saying because they choose the mother, they follow her, making sure she doesn't have any issues, no disease, anything. They follow her whole course of the treatment, and they usually get that amniotic fluid out for when mother has cesarean section. And once they take it out, they treat with the, some safe radiation and everything before they make the product. Does it work? We have no data. Personally, I spoke to one of the scientists who works with the stem cells in the labs, and they told the group that don't use it. because they say there are stem cells there, but there are no stem cells. They are dead. Only thing you're getting is growth factors from that amniotic fluid thing. That's what they told me. So, but they are commercially available, and it's safe. As I said, they follow the mother, making sure there is no disease or anything, and then treat her well. And obviously the adipose tissue I don't use because of stipulations I described. You know, I'm not going to inject that very thick gooey liquid in somewhere. It's basically kind of fat grafting. So it doesn't work. I cannot inject in the joints or the disc. Only thing I can inject in the big joints. So I want to get something that's I can use everywhere.
Do you have to be under general anesthesia?
No. It depends upon how your tolerance with the injections, but most of the patients I did so far is just simple Valium. You know, the people are afraid of when you try to get the bone marrow, because there are so many horror stories about bone marrow biopsy, but the way we do it, it barely hurts because we numb up so nicely. The only part hurts, or the only area hurts, is your outer layer of your bone called periosteum. So obviously we do lots of numbing there, very nice numbing, so then you just feel more pressure. When we enter the cavity and when we take out the stylet from the needle, that time you may feel little pressure or little pain because this cavity is under vacuum, right? So now you're opening up, so you feel like pressure, and that's it. Obviously after the procedure you may have some post-procedure discomfort there for a couple of days to a week. Yeah.
You have it done like someone like me on the spine. I guess I always thought it was bone, but I caught something that you said that it's muscle. Now, does it heal the muscle so the muscle will grow and get healthy, or?
So when someone has a muscle pain, a muscle spasm, 95% time I would say it's a secondary problem to the root cause. So if you have muscle pain around your spine and everything, paraspinal muscles, usually it's because of something going on in your spine. So when there's something going on in your spine, the body is trying to protect the spine by doing the muscle spasm. Body is basically trying to immobile that area, and that's the only way you can do the spasm. Or if you have pinched nerve or something, nerve irritation going on, the muscle supplied by that particular nerve will get spasm, cramps, and pain because that nerve is so irritated. So usually the secondary problem. So if you treat the primary problem, root cause, then your muscle should get less spasm or better later. Then you have to do the exercise to make it, you know, stronger. Now there are certain muscles you develop something called trigger points. So in the trigger points you have lots of bad tender points in your muscles with you feel the bands and the knots there. So sometimes we try the trigger point injection, sometimes start Botox, it doesn't work. Doctors had started injecting PRP in that and is successful. Correct. But that hurts a lot. Muscle tendon injection do hurt a lot because by injecting the fluid, you expanding those things, so it can hurt.
How do they charge you by? Well, you probably don't know that, but by how much work they have to do with the injection?
Yes.
So if you get one injection, it could be like thousands.
It depends where are you doing PR. Either you want to buy Kia, Lamborghini, and wherever you want to use depends upon all those things.
Do you know of any that has worked on the spine, on the back?
I do it. Oh yeah.
And it's worked?
How many knees have you done?
I would say 4 so far. I just started my treatment. I just started a few months ago. Stem cells. I did PRP for a while. I did lots of SI joint PRPs. I think I'm the first one to do the cervical facet joints PRP with 100% success. We actually have presented. We have the presentation done in various societies. The poster presentations. Recently, I had an intradiscal stem cells. One guy I did 4 or 5 months ago. He's 100% better. Actually injected in the 3 discs. The other 2 I just recently did it, so I haven't seen them yet. I did sacroiliac joint PRPs with, I would say, 9 out of 10 patients got better. So I have like I don't know exact numbers. They're all doing very well. I have one PRP failure in the shoulder joint, intraarticular shoulder joint, but she had severe osteoarthritis. She wanted to try it. I tried, it didn't help her. So we have Amanda there. She can assist you with other any other questions, scheduling, seeing me, all those things.
Thanks a lot.
No problem. Thanks for coming.